Hi friends, welcome back to my channel Sharing Simple Knowledge. Thank you very much for your support. Today I am going to discuss the case note of Mrs. Beryl Casey. The date of birth is given 21 November 1941. Otherwise we can use the age is also mentioned, a 72-year-old woman who is being discharged from hospital to a rehabilitation center. So this is a transfer letter. From this hospital she is going to the rehabilitation center. Then what we have to know when we are going to write a letter, first we have to see who is our recipient. That means who is going to read. Accordingly, we have to decide what all information we have to include in this letter. So, where we have to go to see who is our reader? It will be in the writing task. So, let's see who is our reader. Using the information given in the case notes, write a letter to the nursing unit manager, the rehabilitation center, Waterfall. So now we understood the reader is the nursing unit manager in the rehabilitation center, where it is situated in Waterfall. So then our position is not given here. So we must know what is the relationship with this patient we have, who is the carer. So we can use registered nurse like that because she is in our hospital and is going to be discharged to this rehabilitation center. So there is nothing to be worried, just we can write registered nurse if it is not mentioned. So let's move on. Then before we proceed, what I have to tell, when we think about what is the relevant information, we have to ask two questions. Is this information is relevant the current situation of the patient? Or the second question is that whether the reader needs this information to provide the care for this patient right now. So if it is a past medical history and it's not relevant for this current situation, we can omit it. So it's not a relevant information. I think it's clear for you. So let's move on. So the marital status is mentioned. She is widowed recently. Family, she has 2 children. Son lives locally and daughter in the state. Then the social background, lives alone in 2-bedroom house with stairs to entrance. Son married, 2 children, 6 and 8, lives 20 minutes away, visits twice a week, enjoys gardening. So from this information, you can decide whether you have to include this information. Until this period, it seems like it is a irrelevant information. Then medication, antihypertensive medication 10 milligram. So it is an irrelevant information because she is going to take care of this patient. Then the admission date 4 to, I think it's 4 to 2014 at 12 o'clock, fainted getting out of bed and fell to the floor, found by son 2 hours later. So it is an unwitnessed fall. They just found her on the floor. Then the X-ray confirmed fracture left neck of femur post fall. Then what is the treatment they have done? Left hemiarthroplasty, Austin Moore hip replacement, that is the type of surgery they have done. Under general anesthesia, incision closed with the staples and 2 exit drains are there. Then post-operative period, intravenous therapy, 3-unit packed cells with IV Lasix, the generic and trade name is given. Furosemide 40 mg therapy after each unit, intraoperative and post-op period. Maintained IV therapy for 36 hours, then ceased and oral fluids are encouraged. So these all completed now because she is going to discharge. Then intravenous antibiotic cefazolin for 3 days. 3/7 means 3 days. Because 7 days are 1 week. Course completed already. This was also finished. Then vital signs, BP became hypotensive 95/60. Other observation within normal limits. So this one we have to inform them. This transfusion, this one we can just write treated with antibiotic. No need to mention it's completed and shifted to oral like that. No need. Then what they have done for the hypotension? Antihypertensive medication reviewed by doctor, dose decreased or half. Now ramipril 5 mg. Then how the pain was managed. Patient controlled analgesia with fentanyl for 36 hours. Pain relief satisfactory. Commenced oral analgesia 36 hours post-op. Panadine or Panadol 4 times 24 daily, 4 times daily. PRN maximum 4 doses for 24 hours. Then wound management dressing done. Total 600 ml hemoserous fluid discharged from the exit drains over 24 hours. Drain tubes removed 48 hours post-op day 2. So no need to mention this information because it's already removed. Alternate staples removed day 5 and dressing change. So that one already completed. Then the day by day improvement and what all procedures carried out they are mentioning here. Mobility and activities of daily living. Day 2, sitting out of bed, short periods with the full assistance. Then day 3, mobilizing with the pickup frame and 2-person assistance. Day 4 was uneventful. Day 5, mobilizing short distances with the pickup frame and 1-person assistance. That means there is improvement because before she requires 2 persons assistance while now she requires only 1-person assistance. Abduction pillow when resting in bed. Anti-embolic stockings in situ for 14 days. That means it has to be remained there for 14 days. Activities of daily livings, full assistance. Uneventful day, preparing for discharge. Then day 7, patient is, that is the day of 10th February 2014. Then discharge to the rehabilitation center. No, the discharge date will be 11 because the patient admitted on 4th. Then after 7 days means 11. So we are preparing for discharge tomorrow. So we have to write the date as 10 February 2014. Then discharge to the rehabilitation center. Discharge medication ramipril 5 mg daily, paracetamol 1 gram, QID PRN. That means 4 times if required, like if there is any pain. Family to be notified of transfer. Hospital transport arranged for 11 o'clock. Then repeat check of hemoglobin. Then monitor BP, BD for 3 days. Due to adjustment in antihypertensive meds, assess for rehab therapy inpatient and on return home. Then day 10 removal of remaining staples. Wound can remain exposed afterwards. So from this what all information we have to include, we can put a tick mark. Then the other one, what we no need, we can put a cross mark like that. So it will be easy for you to recognize. While planning, you have to, the reading time is 5 minutes. At that time you can plan in your mind, and again when you the writing time starts, you can take 5 minutes for planning again, and you can just mark the relevant information. So it will be easy for you to write clearly and include the all relevant information. So let's see one example letter, how we can produce one. So as there is no mention here, name mentioned here, only the position. So we can write the nursing unit manager, the rehabilitation center, Waterford. So the date is 11th, the patient will be discharged. So we can write 10 February 2014. Then dear sir or madam, or we can write dear nurse because she is a nurse. We can put the salutation like that, dear nurse. Reference Mrs. Beryl Casey, comma, age 72. Otherwise we can just use the date of birth. Both of them are correct. Then how we can write the introduction? The initial means the way we are introduce the patient, or what we are going to request. So we can write, I'm writing to refer, or I am writing to introduce Mrs. Beryl Casey, who is recovering after left hemiarthroplasty. She requires further management and rehabilitative care following her discharge tomorrow. Or we can write after being transferred to your facility tomorrow. Then next paragraph we can write how she was admitted and what was the findings like that, what is happened during hospitalization. So Mrs. Casey, who is hypertensive, so we can no need to write a social history because it can increase your word count. So we can just include there. Was admitted to our facility following a fall at home 6 days ago. That means we are writing on 10th. So it is clear for them the admission date is 4th February 2014. Her X-ray confirmed the fracture on the left neck of femur, for which she underwent the aforementioned surgery. Then what information we can produce here? Post-operatively, what happened? She became hypotensive. Therefore, her antihypertensive medication dose was half from 10 milligram. So that has completed. Then next paragraph we can write during and after the procedure, because it's mentioned here intraoperative and post-op. So in order to achieve more score, what we have to do, try to paraphrase or use synonyms. Don't copy the same word from the case note. It can reduce your score. Mrs. Casey was transfused 3 units of packed RBC. Then she was treated with intravenous fluids and antibiotics. Her pain was managed with fentanyl followed by Panadine 4 times daily as needed. And then we can write which needs to be continued. The other way we can write the Panadine 4 has been commenced like that. So no need to write it again which needs to be continued. I think it's clear for you. Then we can mention in addition wound dressing has been performed for her. Even though it's not mentioned there, it's okay. Then what is it? On subsequent days, Mrs. Casey's exit drains were removed and she was mobilized out of bed. Then her alternate staples were removed. Currently, she is able to work with the help of a pickup frame and one person assistance. Then there is a contradicting factor there. So we can write, however, she requires full support for daily living activities. She is also on anti-embolic stockings, which needs to be there for 2 weeks because it's mentioned 14 days. So we can paraphrase it as 2 weeks. Then the recommendation paragraph. It would be appreciated if you could take over Mrs. Casey's care. Strict medication compliance and regular monitoring of her BP are recommended. Her hemoglobin levels requires to be assessed. And on 14th February, her remaining staples can be removed. Because we are calculating the day, because 11th she will be discharged. That is after 3 days, that is the 14th February. Can combine this data there. On February 14th, her remaining staples can be removed, leaving the wound exposed. Then even this one we can mention, please review rehab therapy in your facility, that means inpatient and on return home. The other things are not relevant for taking care of this patient in their center. Then the concluding sentence we can include, please do not hesitate to contact me if you have queries. As the name of the reader is not mentioned here, but you can write yours faithfully, then registered nurse. I think it's easy for you to understand, and if you require more clarification, just comment below the comment box. Thank you for watching my channel, and please subscribe and share this channel if you like it. Okay, thank you, bye.